Hi, I'm making this video because I'm about to have a surgery done tomorrow, a microdiscectomy for my L5 S1, and I just wanted to make this video to kind of go over what I've been going through as far as what my symptoms have been, what I've tried to alleviate the pain, and ultimately what the surgery results are, and then make follow-up videos one day, a couple days, weekend, let you know what the recovery is like for surgery, so that if you're looking to get the surgery or to try to figure out the source of your pain, that you might have better luck than I had as far as the time it took to get to this point. So first off, symptoms that I've been facing have been just a really severe pain, lumbar radiculopathy, which is a shooting pain basically, not necessarily localized to the low back, even though that's the source of the problem. It's shoots down pretty much in just one side for me, my left buttocks, kind of the greater trochanter area, or hip capsule right there, and down the back of my thigh, behind my knee, down my calf. Not necessarily all at once, but various times. In fact, the pain's actually really difficult to localize the exact source of where it is. So the doctor asked me, where's the pain? I'm almost like, I'm not sure. It's all over the place. It's just shooting and it hurts like hell. So that's kind of the pain summed up. As far as what I was going through, and I'd seen several different practitioners, physical therapy, chiropractors, so I'll kind of go into what I've tried so far to alleviate the pain. I went to physical therapy and massages for maybe a year and a half now. The pain's been going on for about 2 years, and I haven't been able to find a resolution that way. I had to quit working actually about 6 months ago. I went on leave because it hurt so bad to sit down. Most of my pain came just from sitting. That'd be pretty much the way I could spark up the pain real quick. Didn't really hurt when I slept, when I laid down, standing, walking. That didn't bother me at all. It was just the sitting. So quit working to focus on getting better with the chiropractor and massages, and doing this really conservatively, and unfortunately to no avail. The pain continued even though I wasn't sitting anymore. I can't sit for more than just a few minutes. What else I've tried? I've tried Advil, non-steroidal anti-inflammatories. Advil's pretty good. Relafin, they do help to alleviate the pain, but it doesn't fix anything, and really all it's doing is covering up the source of the pain. So as soon as I stop taking the Advil, I get the pain immediately. So it's your body's saying, hey, something's wrong here and you haven't fixed it. So I'm not just trying to cover this up. We want to fix the problem. I tried several injections, both to help diagnose the source of the pain and to alleviate the pain. First injection was, I actually had 3 separate injections 2 weeks apart, which were epidurals into the L5 S1 region, which didn't prove to be very successful for me. And it kind of gave me the impression that this wasn't necessarily a nerve pain. It was could be a musculoskeletal pain, or a pain, a ligament in the pelvis, something else, in the hip. I wasn't sure. I don't know. So I tried I had 2 injections in the piriformis muscle, which is a muscle that is innervated by the sciatic nerve also, which is what causes what's known as sciatica or radiculopathy. And they didn't help me at all. Massages of the piriformis muscle did help quite a bit actually, and loosen that up. It did alleviate a lot of the pain just for about the day of the massage, and that's it. And then I did injections into the sacroiliac joint, the SI joint, and the injection in the SI joint helped quite a bit. And that was another sign to me that, hey, maybe it's the joint, maybe there's something wrong here, that isn't the nerve necessarily. Also, I had 2 caudal epidurals, which are an epidural where they shoot basically the bottom of your tailbone. The steroid medication goes up inside and reaches up into your lumbar area, up as high as L3, if I'm not mistaken. And those weren't very helpful either. Lastly, the treatment that I tried was something known as prolotherapy, which is somewhat controversial therapy, very expensive, and what I found out was pretty painful to endure. You get several injections into the ligaments in your back that make up the surroundings of the joints, so like the sacroiliac ligaments themselves were injected with a dextrose solution, which kind of initiates the healing process over again to strengthen weakened ligaments. The practitioners that were doing the prolotherapies, and these guys, you know, they're veterans in their field of study, they swore that the nerve wasn't causing the pain necessarily, and it was a cause of musculoskeletal pain, the ligaments. During the course of this therapy, part of it has to do with a really strong stretching and exercise protocol, which was very painful, especially trying to touch my toes and bending in that motion. Straight leg on my left side is nearly impossible, and trying to stretch to do that just became excruciating and kind of pushed me to a new level of pain. This is about 2 months ago, and I pretty much lost functionality to the point where I can't really walk, and almost kind of left me, I couldn't really do anything. Wasn't going out anymore, hanging out, doing anything, just always in pain. But I think trying to push myself past that pain point, and at that point I kind of realized there's something caught, and I know, you know, your nerve is going all the way down your spinal cord and down your leg there, the sciatic nerve, and that could be a, you know, that catching right there. So it brings me to the conclusion of the nerve pain, and me visiting the surgeons for the nerve pain. Another thing I did, actually, let me back up real quick, for the diagnostics was a nerve conduction study. The nerve conduction study is where they stick a needle inside various muscles which are innervated by specific nerves, and they can test for weakness or irregularities, and, you know, see if there's something looking like, you know, it's just not working properly. And for me, it showed that everything was working fine and that there wasn't anything necessarily wrong with my nerve. So another sign that, hey, there's nothing wrong with the nerve here, it's got to be something else, which led me to continue to try other things and avoid the surgery and be as conservative as possible here. Nothing's worked, and so I have a surgery tomorrow morning at 5:30 in the morning. Right now it is about 10:15 at night. No eating, no drinking, anything anymore. Head out to the surgery, and I've done a few things to prep, clean my house spotless, shaved, everything, you know, clean up. Ready for the surgery. So what I'm going to do is get a couple videos out to you after the surgery. I'll do one probably the day after, and then probably a week after, and see how we're at there. And hopefully anyone that's looking at having the surgery done, they're about to have it done, just kind of want to know what to expect, or they can match up some of the symptoms that I've given you so far with their own situation. Hopefully it can save you some money, your time, and a bunch of pain. Alright, you guys have a great night, and wish me luck.